reporting radiography is something that is really interesting to me, but I quite like the idea of ultrasound as well.
He should have no interest outside radiography and should only be studying.
Well, I still am a qualified veterinary nurse.
Hello, everyone, and welcome to the Skilled Personnel Podcast, a podcast aimed at supporting and empowering the radiography profession. In each episode, we'll be exploring insightful conversations with both diagnostic and therapeutic professionals, including students, share their stories with you, and delve into the latest trends and innovations, including career pathway opportunities for all radiographers. So whether you're a seasoned professional or just starting out in your career, this podcast is here to inspire and connect all of the radiography world. So a brief introduction on me. My name is Fodi Kyriakos. I've spent 20 years working in radiography workforce, and my co-host.
Hi, I'm Boz. I'm a advanced practice reporting radiographer. Been working for about 12 years now.
Fantastic. And this is our first series on routes to radiography, and I'm absolutely delighted to introduce Ryan Hunt. Ryan, when we met maybe about 4 to 6 weeks ago now, I was just blown away by your story, just in terms of your particular routes to radiography. I wonder if perhaps you could just introduce us to you, what you're doing now, and perhaps what led you towards becoming a radiographer.
Yeah. So my name's Ryan. I am currently in my second year studying my degree in diagnostic radiography and medical imaging. And beforehand, I still am a qualified veterinary nurse. So I'm an RVN on the RCVS register, and I have been doing that for 9 years now.
Wow. So I guess that's a good place to start, isn't it, Boz?
Yeah, definitely. So, how how did life lead you to veterinary nursing?
Yeah, so I think I was about 16 years old and I studied a level 3 diploma in animal management. And as part of our work experience, we obviously went off into the industry and I decided to go for the veterinary industry. I think the reason why I ended up doing it was because my auntie was a receptionist and it was just something, we can get you in here if you want, into a hospital practice. So it was a first opinion practice, like a basic vets, but they had a hospital status, so very, very big practice. And I think just from there, I was just kind of in awe of the nurses because they were incredible. They did so much and they were really empowered there. And yeah, it kind of started from there. I One of the nurses sat down and helped me look at training practices, and I finished my diploma. And about 3 weeks later, I'd actually was lucky enough to start my job as a animal care assistant, with the route of going into veterinary nursing
Oh,
on
so
their
cool.
apprenticeship scheme. Yeah.
Do you think the apprenticeship was the right choice? What's the other route? Can you do like a degree type entry, like a
Yeah.
course?
So yeah, that's right. That's right. So you can do a foundation degree. I mean, I was 17 when I started the job, so I was probably a bit too young to start the degree. As far as legality goes of it, I think as an animal care assistant starting that young, you can stay away of things like like for health and safety. You can stay out of the X-ray room whilst it's on
Yeah.
and things like that. So yeah, I was. At the time, it was definitely the better option for me. I don't think some people are lucky enough to kind of get into a role like that quickly. Um, but I had previous experience working at a boarding kennels, which I obviously included in my open letter, and obviously I was studying as well. And yeah, I think at the time it was definitely a really good idea to do the apprenticeship. As far as the apprenticeship versus the foundation degree route are, I mean, they're both the same amount of time. They're both approximately 3 years, and you will end up on the register regardless of
Yeah.
what route you take. With the foundation degree, you have this thing called so for both routes you had a thing called an NPL, which stands for Nursing Progress Log. And when you did the apprenticeship like I did, it takes pretty much the whole 3 years to complete it. and it will be things like as simple as admitting a patient to placing an IV catheter to monitoring anesthesia to preparing a surgical site. So it really is the whole of the nursing profession, really, on a very basic level that they just want you to tick off. And as I said, so from the apprenticeship route, you do it for the whole 2.5 to 3 years, and for the degree route, you have a year out. I think it's literally between your. I think you for the degree you do your first year, and then in your second year you are in practice full
You just
time,
have to
completing that.
fill out that whole thing.
Exactly, yeah. So yeah, you complete the whole thing within that year, and then you're back in uni for the last year. And then some nurses, I believe, go and do their honours degree, but I wouldn't know too much about that, I'm afraid.
No, it's cool. So you're in your second year of radiography now. So you were in
Yes,
the veterinary nursing for 8 years, pretty much before you kind of fully committed to this.
yes.
What made you originally, first of all, just think you wanted to do something else? But not only that, why radiography?
Yeah, yeah. So I think what happened was I qualified um, because I didn't actually start my training until 2015,
Okay.
2017. I started my training. So I was in practice for a few years before I started. Qualified just after lockdown. Unfortunately, I was meant to qualify a lot sooner, but because lockdown obviously happened,
Yeah, the world
it got
stopped.
exactly, yeah. So it got postponed a little bit. And once I qualified, before I even qualified, I was looking into postgraduate certificates for nurses and ways of specialising because although I loved my job, it just wasn't enough. I was missing something. I don't know what it was at the time. I was just missing that extra oomph, I
Yeah.
think. And the practice that I trained at, I mean, which I'm actually still working at now. I've gone back there just to get a bit of extra money, but it's a very small practice. It's great for training nurses, absolutely brilliant, and the vets stay there for a very, very long time as well because it's just the brilliant work-life balance. But it is very, very small, and I think the caseload can be. It's also a private practice, so it's not corporate.
Hmm.
So it can be a little bit slow getting to a
Yeah.
progression, I guess. Um, so I just wanted that little bit extra, and I was looking at the postgraduate certificates for nurses, and then I thought, why don't I just take the leap and look at going to vet school and becoming a vet? Um, so the progression for that for nurses into vets is the same as I guess it's the same as kind of I say human nurses. You might think that sounds a bit weird, but it sounds totally normal in a veterinary
No,
profession when you
that's
say
fine.
human medicine, human nurses. But for human nurses going to be doctors,
Yeah.
it's not something which is done really, as you don't hear of it very often. So it's for kind of the same for nursing. There's not really any progression route to go from your nursing degree or diploma into a veterinary degree,
Okay.
unless you were to do the BSc honours, and then you could perhaps go on to the 4 year entry degree.
Yeah.
But even so, it's obviously there's not many places available, not many universities do it. So I ended up doing a access to higher education diploma because unfortunately the level 3 diploma in veterinary nursing is pass fail. It's not graded any higher or lower than that, and unfortunately it just doesn't really account for much if you're trying to get into uni, unless
Yeah.
obviously you're looking to up your nursing diploma to a degree. So I did my access course. I got really, really good grades in it. I was really, really chuffed because at school I was not the smartest, but I got really, really good
Oh,
grades in my access
exactly the
course.
same here. I did the access course. I surprised myself.
Okay, yeah. No, I was really chuffed. The entry to veterinary medicine it's really, really difficult. I'd say it's difficult. I mean, I applied twice. I applied once when I was studying my access course. I did it full time as well as
Yeah.
working full time. And whilst I was studying it, I didn't get in, but two other people on the course did, who weren't veterinary nurses either. So it just really goes to show that it doesn't really unfortunately account for much getting
Yeah.
into it. But once I got my grades, I thought I'd owe it to myself to at least apply again, and I applied again, got in. Um, was like, yeah, it's great. I was working, I'd left my training practice at this point and I was working at a referral centre, which is I kind of guess where the radiography route came into it, because at the referral centre we worked with qualified radiographers who had moved from the human human
Yeah.
radiography to veterinary. And I seeing them whilst I was applying to vet school made me think, oh, that that looks pretty cool. That's something that I could perhaps look into if vet school doesn't, if I don't get in again. Was fortunate enough to get in again. So I started. I don't know if you guys know the term locuming. You probably
Yeah.
do, right? Yeah, locuming. Yeah. So I started locuming as a nurse just to get a bit more money behind me before I went to uni. Because I'm from the south, so I'm from the south of England, Southampton, and I was going to be moving to Bristol. And obviously, as a mature student, when you've got some ties already, it's going to be quite difficult. So I started
Yeah.
locuming, and it was within that locuming stream that I realised that working with more vets, that perhaps actually it's just not for me. Nothing against the vets or how they worked
Yeah.
or what they did at all. I just think it was just something that wasn't for me. And yeah, I applied through clearing to my university and got in, and I'm really thankful for it. And since being on, I'd never stepped foot in a hospital, and since since going to the hospital, I can confirm that I really have made the right decision, and
Real.
yeah, I'm really really happy. Yeah.
Humans aren't so bad after all.
No, no.
That's brill. That I like the fact that it wasn't a drop back. It wasn't a second choice. You explored what you thought you wanted to do,
Yeah.
but you managed to get the closure that actually it wasn't, which
Yeah, I
I
think
think makes it better for you.
yeah, I think being in a profession, I'm 27 now, so I started at the end of towards my 18th birthday, and I think the veterinary profession was all I knew. I didn't know anything else.
Yeah.
I'd done animal management. I'd worked at boarding kennels. I'd gone straight into the veterinary industry, and then from there it was another vet practice, and then from there it was locum. I just didn't know anything else, and I think it was the opportunity to speak to the radiographers when I worked at the referral practice, who were really the way that they were talking about their work and stuff. It was great. I even really liked it within the veterinary industry as well. It was they did a lot of cool stuff which I really enjoyed, and their
Yeah.
knowledge was really great, and it was just something that clicked there, I think.
I think I
That's
wonder if I wonder if that's part of being that mature student and not it being your first career path, Ryan. Whether that
Mm.
opportunity, as Boz alludes to there, which is that um, you've you gave you time to think about what it is you want to do with your career, because it's very interesting to think about the different paths that people take to become a radiographer. You, as a mature student, had that opportunity to just consider it a bit longer.
Yes, yeah, absolutely. I think although with a lot of the kind of 18, 19-year olds in my cohort at the moment, a lot of them, it was their number one choice to become a radiographer, and that's really, really great. And I wished I'd discovered it sooner. I wish that was what I wanted to do, but I just think at the time it was just vet nursing that I was interested in. But now coming into it, at a lot more older, I think I'm probably at a bit more of an advantage in the sense that this is I can't I can't back out. I don't want to back out. This is definitely what I want to do. I've had and as you said, I've had a bit more time to think about it. And I think as well, if I were to study a degree at the age of 17, 18, I wouldn't have done very well either. I was not very academically inclined when I was younger. It took it took me my vet nursing to realise that I did have a bit more academia behind me, and I was a bit better than I thought I was. But yeah, school grades were not good.
yeah. My
And
school were happy to see the back of me as well.
Yeah.
do you know, to that point, and Boz, we were Boz and I were discussing this around the mature students. Do you have, well, first question, Ryan, are you one of how many mature students on your in your year?
It's a good question. I think it's probably about a 50-50 split. So I think currently in our cohort, um, I think we started off around the 60s, the 60 of us, which I think probably was more younger student inclined. But now we're about 40, 45, I think. And yeah, I'd say it's a pretty good split. At least that's from what I see, the people who turn up to lectures. But yeah, I'd say it's a 50-50 split.
Uh, Boz, it was interesting when we was talking about this because one of the things we're thinking about, and perhaps you can just bring this to life with Ryan, is around how that dynamic works between, as you say, the mature students and the school leavers. Let's say in terms of perhaps almost a bit of mentoring. But Boz, you had a thought on this, didn't you?
Yeah, so I was a mature student when I went to university, depending on the how you think of mature, age-wise. Anyway, do you think a couple of things? You've mentioned it already that you think you would have done differently had you been a school leaver. Do you think that it's made it easier to come in and, put your head down and get it? Do you think you have what do you think regarding the cohort of the mature students, for want of another word, versus the school leavers? I don't.
Yeah.
There's pros and cons to both. As you said earlier, you wished you'd got found it earlier. But what do you think the strengths are for both entry points?
Yeah. I mean, I think with regards to the school leavers, it's quite good for them to not stop their education. They haven't stopped their education. They've
Yeah.
gone from A level straight to degree, which I think you're in the headspace. You're going to keep it going. What I think is obviously they don't have the experience of moving away from home. It's a great experience for them to move away from home, which I think they seem like they're doing really well. Um, but as far as the mature students go, I think it's a real mix because we've got parents in our class who really struggle with. We've got someone who comes from the Isle of Wight, bless her, and she's a parent. And she comes over for the lectures, and it's difficult for her to do that, but she does it, and it's great. But I think it's it is this kind of like mature student versus younger student situation, but I think actually it's a lot more than that. It's actually home circumstances as well. As I say, I'm not a parent, and I live with my partner in a flat, and we get on with it, and it's fine.
Yeah.
I don't have the challenges that the parents have. Having said that, I can expect as well that the younger students do have challenges. I just wouldn't be aware of them because I didn't start at that age. But yeah, I think it's really individual. I would say it's really, really individual. As I said, the parents I really do feel for, but they're here. They're in second year, done well.
Yeah, it's quite an achievement juggling that. That's really
Yeah.
good. Have you got anything else that you wanted to follow up on that, Foddy?
Yeah, I think just my sort of thoughts on that is that the the thought process between deciding what part of radiography you enjoyed the most, and then having to think about how you want that to shape your career at this early stage, as a year two student, just thinking about the bigger picture almost, or are you not thinking that far ahead at this stage?
I definitely am thinking that far ahead, and again, maybe this is the kind of divide between the younger students and mature students. It's not so much. I mean, it's obviously a big part of it is the fact that where do we want to see ourselves in 5 years' time? And I think that goes for everyone. Do we want to see ourselves continuing in plain film radiography? Do we see ourselves progressing into the cross sectional ultrasound reporting? But I think actually it's. I think everyone kind of is a bit taboo about the subject, but I think finances has a really big kind of like impact in it as well. Do you see yourself as a band five? Do you see yourself progressing to band six? It's something to think about, and it's definitely something to talk about. I know that I want to progress. I know that I want to do well, and I know that I want to feel really, really empowered within my role. At the moment, the plain film radiography certainly does that for me. But the reason why I moved over to this progress, one of the main reasons I moved over was because the veterinary profession didn't give me that oomph to do more. There was not much more to do. Um, so yeah, I've definitely had to think about it, and I think again the mature students are definitely thinking about it. Whether they're thinking about it more than the younger ones, I don't know, but it's something we often all talk about quite a lot.
Yeah,
Bod.
it is often so I'm rolling on from that looking forward thing. I'm a big advocate, especially in your first year, 2 years post qualification. Just get your head down and get your basics, get your experience up, and don't really think about where you want to go too much. I'm not saying, however, you're as a second year, it's quite interesting because first year is just information overload, just so much new stuff that everything's fascinating. Second year starts to become much more academic because you've kind of got the basics of the radiography and you can start to pay attention a bit more to what's going on around you, the specialties, the people you start to get access to a bit more. Has anything caught your eye yet?
I yes, yeah.
Even stuff you don't like. So like straight away, it's quite good sometimes to realize, okay, that's just not for me, that side of
Yeah,
things.
yeah. I think I like the idea of having the autonomy of the reporting side of things. So I the idea reporting radiography is something that is really interesting to me. But I quite like the idea of ultrasound as well, where you get you're doing your scans and you're reporting on your own scans and you're kind of seeing that through. I
Yep.
really like that. I think one of the things that about normal kind of like normal digital radiography is that you do the X-ray and then that's kind of the last you see of it, which is like like well, I would like to see what the follow up was to that
Yeah.
and stuff. So yeah, ultrasound in that sense really does appeal to me. The reason why again I got into the radiography side of things was because when I started working at the referral centre, it was at the veterinary practice. Sorry, it was that you don't often see in any other veterinary practices, which are kind of like your normal basic first opinion
Yep.
hospitals. You don't see cross sectional imaging, so you don't see CT and or MRI. In fact, I think they even had a fluoro machine, a very little one. It was like a portable type of thing, almost like a C arm, I guess. But that was one of the main reasons why I went into radiography because I really liked the look of looking at cross sectional imaging and knowing what they're looking at. I think
Yeah.
when you come in from an outsider's perspective, it's just all blurs, isn't it? And
Yeah.
I think just the knowledge of knowing what you're looking at was impressive enough for me to kind of to want to pursue that career. Now being in the industry and having gone to the hospitals and seeing the cross sectional imaging, I must admit it's very fast paced
Yeah.
and it's almost like a conveyor belt, isn't it? It's like in next, 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 and I think, yeah, I don't know if it's something that I would see myself in, but I do enjoy being there, and I always feel very impressed being in cross sectional
Yeah.
imaging. But whether or not I see myself in it, I don't know really. I think again, it's although I've thought about what I would like to do and what appeals to me the most, it's still very open, isn't it? You don't know
Yeah.
what's going to happen in the next 2 3 years, so I'm interested to see cross section. Like I said, cross sectional, it does baffle me, and I love the look of it, and I always think people who do it are super cool. But
Yeah.
yeah, I don't know. At the moment, as I said, I think I've got a few ideas. Yeah,
Yeah. I think that's the best way of looking at it. Finding out where your personal strengths or personal interests may play into it. But as you said, at the moment, ultrasound's slightly higher up in more interesting to you than cross-sectional. However, as you said, you don't know what's going to happen. Third year might come around, and you might have met someone or done something or done a piece of your course, and it completely changes your perspective. I think that's a very I think that's probably also the maturity type thing as well. Whereas some of the school leavers, it's I don't need to think about the future.
yeah,
I don't need to look at the specialties in with the eye of I might do that yet,
yeah, yeah.
which I think is quite good, and it will help you kind of focus a bit more. I think that's really good.
A
Yeah.
question.
Perhaps as well, though, the less mature students would feel less pressurized into it,
Yeah,
I guess, as
yeah,
well. Because for me, I feel like I've got a bit more of a time scale on it, and that pressurizes me a bit, I think, already. Whereas, yeah, with the non-mature students, they haven't got that pressure, and
yeah.
it's
They can
they
just
can find,
relax a bit more and
yeah,
find themselves better. Yeah, that's a good
yes,
way. Definitely.
A question
Go on,
for
Foddy.
both you and Ryan, actually, Boz and Ryan. What fascinates me is personalities and characters that influence your decision in this process. So, when, for example, Boz, did you potentially know that you wanted to become a reporting radiographer when you was a student? Is one of the questions I had, and and one for you, Ryan, as well. In terms of actually thinking about your route, how much does potentially play a part of who you meet during that process and the roles that they play, like your lecturers and so on.
Ryan, do you want to go first? Do you want me to?
you go first.
Fine, fair enough. Funnily enough, I was, I was from day one. I wanted to do reporting, um, but it wasn't necessarily the people. One of the reporters where I trained was just a superstar. The amount of knowledge in her head was insane. What she didn't know about radiography wasn't worth knowing. So she was, that must have been at the back of my mind. However, what appealed to me personally was when I do something, I want to do it well. And the aspect from reporting is you're an expert in your field. You're an expert on a subject. And that was quite important to me, that I was happy in my knowledge of what I was doing. I was a plain film or digital radiographer for many years before I went full-time reporting, and I love that. I still keep my clinical days, and I really really enjoy them. But people coming to me and asking me a question, and I know that they're going to be satisfied with my answer because I've studied it properly, and being able to teach people, that was what really attracted me to reporting. I didn't rule out anything. I liked everything. I liked all the different things. I could have, going back, I could do each of the specialties happily. I'd love to. They're really interesting. But I'm glad that the doors that have opened for reporting, for mainly the teaching and mentoring side of it, I've enjoyed immensely. So it wasn't necessarily people rather than the role.
And Ryan, from your perspective, you're now sort of in your second year. How have sort of the lecturers and the people you've met shaping your sort of thought process on what you already see as a path that you've been interested in?
Yeah, I mean, it's mainly. I think it's probably mainly the people in the hospital which are really opening my eyes to it. Because again, something that I mentioned before is that I never really stepped foot into a hospital before I actually done the course. So going into the hospital, seeing again, I got some time to spend with the reporters, and as you said, it was just the knowledge behind them. It's incredible. Like it's just so it's mind blowing, and I wanna blow people's minds. I think as well. As you said, it was just the I'm just so impressed with the reporting radiographers, ultrasonographers as well. It was so impressed. As far as my lecturers go, I mean, obviously they're really helpful with showing you what there is out there. But I think we've really yet to dive into that at university with the lectures. But even so, going again with the people that I've met and stuff. It was the veterinary radiographers. I wouldn't be here doing this if I didn't meet them in the first place. So I got to hand it to them really. But again, I love when I was veterinary nursing. I still am veterinary nursing. I'm still doing this, but I do love teaching. And again, it's that people looking at you going, "Oh, that's cool." And like, yeah, I can tell you cool things about physics. Weirdly, and like, it's that which I really kind of strive for, I guess. And it really helps me. I think it's going to really help me to make the decision in the future as well as to where I go.
Well, you mentioned that, well, I think Foddy alluded to it, that as one of the more mature students on the course, have you found that you've taken some of the younger ones under your wing in some ways, acting like a mentor in any capacity? Do you think that is a thing, or do you solely see yourself as I'm a fellow student with?
Yeah, yeah. No, I don't think they need me very much. They are. I think as the years have progressed, I look at the 18, 19 year olds now compared to when I was 18 and 19, and I think there's definitely been a change.
Yeah.
They don't seem to be as immature as what I used to be. But I mean, I'm a student rep as well.
Okay.
So one of the student representatives for the cohort. One of three. Two of us are mature students, and the other one is a non-mature student, and I'm happy to help anybody at the end of the day. And again, I kind of take that from my veterinary nursing as well. Like I've always been happy to help people and to teach people. But yeah, as far as kind of the 18, the younger guys versus the mature guys. I mean, I never went to uni at that age, so I don't really know what else I could really advise them on, I guess, because
Yeah.
they're living something that I never lived, and they're doing it completely differently to me. And I'm sure that if they wanted to have some information, if they wanted to help with anything, as I said, I'd be more than happy to advise them on stuff. But even being in hospital with them, you can. I don't really think there's much of a difference. I can see why there should be, and why you'd think there would be, but there really isn't. It's quite nice actually. It's really refreshing to look at it
Yeah.
from somebody else's perspective. Yeah.
Yeah. I found that quite fascinating. The fact that coming into the hospital, it's a complete leveler.
Mm.
It doesn't matter what you've done, or yes, that will feed into your practice. However, the the knowledge base and the getting into being a radiographer, you're all in the same boat. Doesn't matter what you've
Yeah.
come from.
Mm.
However, it will eventually start shaping you into you as a radiographer.
Yes.
With that in mind, your enthusiasm for it, Ryan, is obviously shining through in terms of coming into the profession. What what is it? So, can you bring to life a little bit that point you made around, you'd wish you'd done it sooner? What are the particular bits you could sort of bring to life there?
Yeah, I think it's the responsibility of the thing. Like I said, I know I've not got children, and I've got far less responsibility compared to a lot of the other mature students. But to have uni and placement as your sole focus, I think it's it would probably be. I don't really know how to say it, but I just feel like it makes everything around you a little bit less daunting. I think you don't have to worry about paying bills, or oh god, I've got to work extra to afford to live, I guess. And forming relationships. I think obviously when you're young, I mean, I know when I was younger, I could talk. I mean, I still can talk to anybody, but I talk to anybody, and I think forming relationships, it would probably be a bit easier, I guess. Maybe, I don't know. um I just, I don't feel like I've wasted any of my life doing the veterinary nursing. But to have the understanding of what I actually want to do now, it's just so relaxing, I think, as well. It's just so relaxing to know that I'm in something that I actually, this is what was missing before. And to have known that beforehand, I would have saved myself a lot of kind of worry about where I'm going.
What's going in the future? Yeah.
Yeah, yeah. But as I said, I mean, it's obviously the external factors of living as well, which is difficult as a student. And that's one of the things where I'm like, oh god, uni can just hurry up and end now. But if that wasn't like I said, if that wasn't a problem and I was younger, I'd be living it up. I've always loved education. I've got three diplomas and I'm doing a degree. I've always loved education. A CPD as a veterinary nurse, always go for the courses, things which are going to take a lot longer because I love education, but it just take the love out of it if you've got so much more going on in the background.
Yeah,
What
I get that.
I guess putting my sort of careers workforce hat on, Ryan. It's the only hat I've got, so I'm going to keep that one on. Basically, what comes to my mind is some of these things around. So the guidance aspect of um, if the benefit of hindsight. So Boz did a piece once around from university to uniform, and the thought around guiding people so that perhaps what we could do is support those around. And I'm not necessarily saying, by the way, Ryan, that's your responsibility as a fellow student or a mature student, but just in terms of guidance, I'm really keen to just ask you both, you as a student in currently in year two, Ryan, and Boz, you from everything you've learned, how can we create additional support mechanisms above and beyond what's available? Because I'm sure there's things available at each university, um, and as we could continue to do this, and Ryan, as a sort of thought process for you, sort of above and beyond this, through perhaps the platform and the network, for us to develop greater support mechanisms that could help students in place, whether it's year one, two, or three. But just a thought for both of you. Bob,
Go on, Ryan.
oh, sorry, Ryan. Okay.
Yeah, I think one of the things that, again, I guess everybody's different, but I think just talking, it just does so much, and having something like the Skilled Personnel Network where you can reach out to people, people can reach out to you. You're in this, there's other students on there. Just that open communication is so important. I mean, as I'm a yapper, I'll talk to anybody and I'll talk for England. But I even in hospital, I feel like I've built a really, my first kind of official day back was yesterday, since being there in January on my placement site. And I've got people remembering my name and remembering who I am from a really big radiography workforce, because I think just because I just talk, and I try and treat it like I'm at the vets, like I'm speaking to another colleague, because that's who they are at the end of the day, and they may as well be my future colleagues, I don't know, but just that open communication of just chatting and just being relaxed and talking to people, even if it's not about radiography, just talk if you feel comfortable with it. I think it's really important.
Yeah, I'd have to echo that. I think just during your student years, you do have. I think it's really good, Ryan, that you've made those connections with the radiographers, because I know a lot of people who aren't necessarily as outgoing, or just the way they've been in their placement, they haven't actually formed any real connections, and which means that when you've got downtime in the hospital, very rare, I know, but you've only got your fellow students to talk to, because you don't feel okay or comfortable speaking to the radiographers, who sometimes some of your worries or some of the things you're going through, they've done it already, whereas your students are going through it at the same time. I think having somewhere that you can just kind of go, "Oh, I'm having a bad week because X," and someone goes, "Oh, great, I'm not the only one,"
Mm.
or someone, but in the same place, someone who's been qualified for 15 years can kind of go, "You're right, this isn't a new thing. I had this 20 years ago when I was training. This is how I dealt with it. Do you think you'll find it the same?" So I think that type of talking about it, but also once you're qualified, you're going to see some things in hospitals. That's what we do, that you don't know how you're going to react to them. Doesn't matter what it is. The first time you see some type of injury, the first time you go a major trauma type thing you're faced with. Um, I worked through the Manchester bombings, the Ariana Grande concert, and
Mm.
the thing that came out from the kind of the aftermath was there wasn't enough debrief, and that was from everyone, porters, the domestic staff, right up to consultant surgeons, didn't feel like they could talk about it enough. So I think that is 100% the biggest thing that you can do, Foddy, with this platform, is even if it's literally just one tiny little space of it where people can just go and vent and find someone to vent with and someone to go, that's normal, that's okay. I think that is the probably be my most important thing.
It's really, really important that for me, the support mechanisms at each level in people's careers, and I include students in education, have got that ability to do that, and that was definitely the vision behind it. And it was very, very important for me, Ryan, to have students as an integral part of the network. It's not a radiographer exclusive platform once you're qualified. It's actually to include radiographers who are going for education as well. Just in terms, Ryan, of your thought process now. So you're in year two. You've still got a bit of a way to go. You're halfway there. you've got you've got exams going through your mind at some point. You've got your placement now. Are there any things, any aspirations over and above, like the beyond this? Do you, for example, always plan to stay local for where you are now? You happen to be, thankfully, in a degree which is local to where you live. Is that right? Is that how it's worked?
Yes.
Yeah, and just in terms of that, it's quite interesting to understand people's hobbies and interests outside of work, because one of the things Boz and I spoke about, or we speak about quite often, is always, because one of the other series we're doing is Crossroads. The point at which people get to certain points of their career where they may be thinking about what they're going to do next within radiography. And we want to,
Yeah.
that's the other part of the platform that we really want to maintain, to inspire and spark something. But my thoughts to you are, what are your interests, I guess, outside of radiography and or your current training, and do you feel like you can continue it? Is there, just over to you, really.
He should have no interest outside radiography and he should only be studying.
Study, study, study.
Yeah, absolutely.
I love traveling. It's really been something that I've actually got the opportunity to do a lot more kind of before starting the degree. I think as I was doing the locum nursing and I was earning myself a bit more money, I had a really, really great opportunity to travel a lot. My partner's Italian as well, so going over to Italy and back again, it's really fun. But yeah, I think as long as I can continue with traveling and meeting new people, speaking to new people, that's really kind of what I strive for, I guess. I mean, apart from that, I've got a pretty cool fish tank that you can all I like looking after, but yeah, traveling is my main my drive. I think I love traveling. Although I am kind of at the moment not planning on going anywhere. I live in the south. I love living in the south. I've got everyone around me here. Exploring is always something I love doing.
It's a good thing to have. I've had colleagues in the last couple of years move to Australia, Canada, Dubai, and all can find work because they
Nice.
trained here,
Yeah.
which is really good. And yeah, no, it's good to have your escape as well, be able to jump off,
Well,
clear your mind.
ironically, and obviously influencing isn't for everyone, and neither what am I trying to suggest everyone's got to become an influencer for that matter. But ironically, the our producer and myself had a look before on all of the social media platforms, and interestingly, the radiographer with the biggest social media following was around 40,000. who happened to be vlogging on traveling. So
Wow.
yeah, and he happens to be
Can you
a
stop putting him off the career? He's gonna go. He's gonna go off traveling now.
I'm going somewhere with this. I'm going somewhere with this, and interestingly, he's a radiographer in Kent. It's just like it may not sound glamorous, but you know what? The reason we kind of went down that exercise is really bringing it back to the fact that if you actually look at this person's profile, it's they're a radiographer who in their day job, and somewhere along the line that working as a radiographer has enabled this particular person to continue to do vlogging. And what I think is part of what I would really love to bring to the forefront is, these things probably, he will continue to be a radiographer and advance in his career, looking at his profile. But his interests almost keep him, doing what he's doing on a daily basis. And sometimes it's important to promote that there's other parts of your life that you should sort of continue doing, and that should enable you to able to continue to stay enjoying the other part you do on your day-to-day basis.
Yeah, I wholeheartedly agree. And I think this is something that I really kind of, even with the when I was veterinary nursing, is that no matter how much you love your job, you've just got to have a really good work-life balance because you will burn out. I think it's just that's just one of those obvious things, isn't it? Work-life balance is so important, and it's something that we see so often in the veterinary profession is that unfortunately, there's not enough vets, there's not enough nurses, and the client base, especially since COVID, has just risen so much. There are too many pets, and there's not enough people to treat them. And especially if you take your dog on a walk, more likely they're going to get into a dog fight now because there are too many dogs around, or there's too many cats, and there's just not enough people in the world to treat your animals, and there won't be enough if people don't take that time to reflect and have that me time that they really need. And hopefully that's something that I'm really hoping in the veterinary profession anyway, it's something that we'll see change, because it's pretty bad at the moment, the work-life balance. Yeah.
Yeah. Thankfully, the depending on your employer, the NHS is becoming a lot more open to flexible working, long days, short days, compressed hours, things like that. They've realised that the retention of staff depends on that, because a few years ago, when it was just no to, if you want flexible working, no, they'd just leave.
Hmm.
And that's it's good to see that the culture of management is changing in that manner.
100%. Ryan, from your perspective, would love any thoughts that you would have about anything you want to raise at this stage, and just anything from your perspective. Really keen to promote anything that you would like to. You're working on anything at all. So, just from your perspective, anything you'd want to add from your side?
Don't think so. No, I think we've covered a lot of cool ground here, stuff that is I think is really important to talk about. And yeah, no, I'm just really looking forward to getting through my degree now and coming out the other side, qualified radiographer, really, and continuing with that.
So last kind of closing statement from you, Ryan. Kind of why should someone not only consider radiography, but even if they're in a different career, I mean, you've been working for 8, 9 years. That's a career. Why should people think about changing? You don't have to stick with your status quo just because you're there already. Why should people make that leap?
I think it's just really important to follow what inspires you, and I think it's really important for people to know that actually, no matter what age you are not stuck in whatever you're doing. A job is a job, and you spend the majority of your life doing it. why not do something you love, and why not earn a living off of it? Why not go and travel the world and then come back and continue doing something you love? It's a no-brainer, really. Go and do it. And do radiography. It's really fun.
That's right.
That's what we're going for, weren't we, Boz?
Yeah. No, it's been great talking to you, Ryan. It's really it's nice to see that people are enjoying becoming radiographers.
Yeah.
I enjoyed the amount of information. As I said, I just like information. I like knowing things, and the amount it gives you is not just the radiography side, but as you said, stepping into a hospital for the first time, it's a different world. It's really good to see that courses up and down the country are making you feel like that, and that's a really good advert for the profession, I think.
Absolutely. Yeah. I think it's just so I've really I feel like I've been really lucky to get into it, and to find it. I don't think enough people know about it, maybe, and
Yeah.
I think no, I feel so lucky to have found out about it and get onto it because, as I said, I enjoy it so much. I'd be happy to radiograph people constantly. It's very exciting. It's very you get to meet a lot of new people, and
You definitely
I
do.
love, as I said, I'm a yapper. I love talking. I can talk to patients. I talk to anyone.
Well, I
Oh, no,
think the
it's been
profession's
great.
gonna, yeah, profession's going to be lucky to have you. Sorry, Boz.
Oh,
Yeah,
bless. Thank you.
I know. I'd echo that. Keep. I hope you keep that enthusiasm. Keep going forwards, and I hope you can help other people hop onto the radiography thing.
Oh,
But
thanks.
just wanted to say best of luck. Second year's
Thank
great
you.
fun. Great fun.
Yeah, I've heard.
Nah, you'll be fine.
You know what? Part of what we want to create here, Ryan, is a support. As I've harped on about it, but I can't harp on about it enough, to be honest. A support mechanism along the way with the platform. So always feel you can reach out to myself, to Boz, but any of the people on the platform. That's what ethical code we've created and want to develop on there. So between us all, we
There's
can
some
help each other.
fantastic people on. Some
Yeah,
fantastic people on there. Really good people to know.
yeah, I can see that. Yeah, no, absolutely.
And we're building a global
What?
community as well. So
Nice.
Yeah, I mean, you're in Cyprus.
I know, I know, as the radiographer of this group.
Yeah.
Brilliant. I'm really looking forward to hearing more about your journey, Ryan. Boz, thank you very much. This has been our first, so this is the inaugural uh,
Yeah.
series of Routes to Radiography. I hope everyone will enjoy it. Ryan, good luck, pal.
Thank you. Thank you very
Yeah.
much.
Good luck. Thanks for coming on.
Thank you.